Good afternoon. Thanks very much, Louise. My name is Jane Abdullah, the Assistant Director for Equality and Diversity at the Trust, and I'll be co-presenting with my colleague Harriet Prust, who has led on this particular programme. By way of context, the Fast Track Accessibility Programme was born from in part from the demography of Manchester. 20% of the residents of Manchester are disabled, and that rises to a third in the east of the city, where there's also greater levels of deprivation. We know from research that disabled people are more likely to require healthcare services, but they are half as likely to access healthcare services. And that's because of barriers to accessing services. The Fast Track Accessibility Programme was the Trust's response to that, to fast track improvements to enable disabled people to access our services. The key to the programme really was disabled people being at the heart of service improvement and at the heart of the programme, shaping, advising, quality assuring and co-producing. The Disabled People User Forum was set up from the beginning of the programme and continues till today. In fact, I'm really pleased to be able to say that this morning we had the first virtual meeting of the forum, which is absolutely fantastic. The programme was also developed using desktop research about best practice from across the country and locally. So in terms of design, what was the Fast Track Accessibility Programme aiming to achieve? Well, overall, a more inclusive environment for disabled people, but specifically, feedback from patients has been that if I can see, before I come to an appointment, if I can kind of visualise myself at the Trust and I can make plans for my appointment. And so from that was born these online access guides that Harriet will talk about in more detail. There were 364 online guides produced as part of the programme for every clinic and department in the Trust. And that's 9 hospitals across 6 sites to give you some kind of idea of scale. The aim was also then to improve the environment by raising the confidence of staff in communicating with disabled patients. So specifically, the projects within the programme were these access audits that inform the online access guides, a bespoke disability awareness training involving organisations of and for disabled people in the delivery, and then sharing best practice through a conference. So to tell you about those things and the outcomes in more detail, I'll hand over to Harriet.
So in terms of delivery, methodology and governance, it was really important for the Fast Track Accessibility Programme that it was delivered by a programme management methodology, by a dedicated programme manager, and using an action research methodology. As Jane's already mentioned, we delivered it with disabled people's organisations, of and for disabled people, with our own Disabled People's User Forum, with the external company Accessable and their specialist knowledge, and also the knowledge of our internal teams, which obviously is really important. And then to give you an idea of the oversight of this programme, it was reporting to the Charitable Funds Committee, the Trust Accessibility Board, and our group Equality, Diversity and Human Rights Committee. So I'm going to tell you about our outcomes, because this is really the most exciting part of where we've got to with the Fast Track Accessibility Programme. So for our first project in creating Accessable access guides and the audits which inform these guides, you can see our success measures on the left and the impact they've had on the right. So in terms of the impact, 100% of the improvements to the environment highlighted by the access guides were agreed feasible as part of that work plan, which was actually 3,000 improvements, which is a huge amount of work. Then in terms of percentage of our hospital areas with access guides, 100% of our hospital areas have an access guide now. So if you want to go to X-ray in Manchester Royal Infirmary, you can look that up on Accessable's website and it'll talk you through how to get there. Or similarly, if you wanted to go to X-ray at our Wythenshawe Hospital or at our Children's Hospital, you can do that for any of those sites. Then in terms of the number of people viewing these access guides, so we know that they are being used by our population and being valuable to that population, we had a measure of how much they were being viewed. So when we first released the guides in December 2018, 2,500 views had happened, and when we measured again in September 2019, in a month period, we were getting over 8,000 views in a month, which gives you an idea of how much this has been a beneficial resource for our patients. Next slide, please. So to support the work that we were doing in the access guides, it was also really important to create an environment that was emotionally safe for our disabled patients. So we also ran some disability awareness training. Again, here you can see the success measures on the left and the impact on the right. But I think that this is best measured through this comment that we've had from a member of staff through our surveys, which is, I will feel much more comfortable about asking a person with a disability what I can do better to support them and what they might need from me. I think prior to this training, I felt generally reluctant to ask this question for fear of offending someone. So for me, that's what this is about. It's not about equipping our staff with all the knowledge for every individual patient, because our patients know themselves best often. It's about equipping our staff with the confidence to ask our patients what they need to ask them to ensure that we can make reasonable adjustments, whether that's in our emotional environment, whether that's within our physical environment, so that we can provide them the best care experience. Another thing I'd like to pick out from this page is our conference, the Access Matters conference, and 97% of the attendees said that they had increased their knowledge of accessibility by attending the conference, and 94% said it had given them ideas for how to improve their own department's accessibility, which is absolutely wonderful. Next slide, please. So wanted to give you also a really concrete example of what we've done as part of the accessibility programme. So this is Wayfinding. Wayfinding is a big challenge for us. We are, I think, the largest trust in Europe now. We see like almost 2 million patients a year. We're spread over 6 sites in a big city with 9 hospitals. And this is just one of our sites. This is our Oxford Road campus. We've got 4 hospitals on this site and 2 car parks. And if you're a patient before the Fast Track Accessibility Programme, you can often park at the wrong car park to get to the hospital you want, which can be very frustrating. So wayfinding has been a really big thing for us. And based on the feedback from our Disabled People's User Forum and from our public and our staff as well, we've created this new wayfinding system, which has been really well received within the hospital. Next slide, please. So just to tell you quickly about sustainability, really important to the programme was building in mechanisms for continuous service improvement. It's been core to ensuring the future success. So just to share some of these solutions, governance identified for work plans resulting from the access audits, building ongoing reporting for the online access guides viewing figures, deep linking our online access guides into our website. So if you go to our website for, I don't know, maternity services, you'll get the link to the access guide. Identifying business as usual leads, very, very crucial. Creation of an online disability awareness solution, and continuing to share practice and progress on pledges. Next slide, please. And this is our key learning. So to share with this great community some of the key learning from the Fast Track Accessibility Programme, which we called FTAP in the end because it was a little bit shorter, was to define aims through consultation and evidence. So the reason this programme was so successful was because disabled people and patients formed our aims for us, so we were doing what our communities needed us to do. Focusing on outcomes from the start, so often we can get bogged down in process things rather than what are we actually looking to achieve. Conducting stakeholder analysis and creating communication plans, really key in an organisation our size. Working with our target audience and securing buy-in from our leadership were our key points.